Welcome to the program, Dementia. It's something we hear about. We all know somebody that's had a friend or a relative who's had it, and your heart goes out to them. But until you've had it happen to you, a relative, a very near and dear friend, you just have no idea how bad it is. Literally, people who, by all, how do you say this? I'm trying not to get emotional. A friend of mine, I'll mention his name, Carter Edwards, my mate, my mentor. Any of you that followed me on 2SM know who he is very well. For those that don't, remember the Taubman's paint commercial, I Did It My Way. He was an entertainer as well as a conservative talkback host, and a guy that I became top mates with, lived 2 suburbs away from me. We drove to work most Saturdays, every Sunday, and spent an immense amount of time in the car, an hour up, an hour back, and a lot of time at work when we did these 6-hour shifts. And I saw him change over time. It was horrific. And towards the end, he literally didn't recognize me, one of his best mates, and his best mate, Roy Cooper, of 30 years. It was heartbreaking. Still, we went to visit him. And if anybody could have prevented that from happening, it would have been God's gift. I have a woman who can absolutely advocate for better outcomes and tell you how to achieve them. Her name is Dr. Helena Popovic. She's a medical doctor, a best-selling author, and an international speaker who shows people how to boost their brain so they can perform at their peak throughout their career, eliminate brain fog in menopause, and avoid Alzheimer's and other dementias in retirement. Her philosophy is that education is more powerful than medication. I love that, by the way. And she believes in growing bolder rather than older. Dr. Popovic is also the author of Can Adventure Prevent Dementia, a guide to outwitting Alzheimer's. And you can get that, and we'll tell you a bit later where you can get that. Welcome to the program.
Thank you very much. Pleasure to be here.
Wow. I mean, if I had a time machine, I'd go back and talk to you 10 years ago, possibly change the diet or do whatever it is that you're going to advocate we do for my friend. Where do we start? Do we start by talking about recognizing the signs? Is that where we start? Or should we start about just preventing this before there are any signs?
Preventing this before there are any signs. It is never too early. It's also never too late to start boosting your brain and start protecting your brain from decline. I think the first thing to say is that decline in brain function is not inevitable as we age, even though most people think it is. Look, some aspects of brain function can slow down, but other thinking abilities actually improve. And the first thing is to notice that and not to talk yourself into aging. Like, for instance, vocabulary, reading, verbal skills, verbal reasoning improve with age. Older adults have larger vocabularies, deeper understanding of different layers of meaning that can be tamed within a word. We're also better at pattern recognition, seeing the bigger picture, extrapolating. If you like, older adults are better at seeing the forest, maybe not quite as good as seeing the trees. But I think the first step is not to talk ourselves into aging. I'll give you another example. This is a really fantastic study by Harvard professor of psychology, Ellen Langer. She questioned 3 groups of people about their beliefs about memory and aging: North Americans, mainland Chinese, and members of the deaf community. And apparently, I didn't know this, but mainland Chinese and members of the deaf community don't have the belief that your memory declines as you age. It's not part of their culture, whereas Americans, Australians do believe that. And sure enough, as she followed them as they aged, the Americans did have a decline in their memory. The Chinese and the deaf people did not. So the first step in aging better is to feel better about aging and to know that decline is not inevitable. So I just wanted to start the conversation with that, because often we just you forget your keys and you go, oh, I'm having a senior moment. It's the beginning of the end. No, you were maybe tired. You were distracted. You weren't thinking about what you were doing when you were putting the keys down. When you're young, that's how you rationalize it. When you're old, it's doom and gloom.
When we had that study done, and you did note that the Chinese fared better and deaf people as well. Now, with deaf people, I guess they could have been multiracial. I don't know where the group was of deaf people, but certainly when it comes to Americans which are very multicultural versus a monoculture in China for the most part, can we put that down to good genetics, or can we put that down to something else?
They looked at genetics. There was nothing in their genes to explain the better memories. It was put down to their cultural beliefs and the fact that in many Asian countries, it's lessening now, but they revere their older generation. Old people are seen as wise and able to contribute, whereas in Western cultures, they're often seen as, frail, irrelevant, a burden on society. So it's very much about how we perceive ourselves. That we don't realise that ageism is still a huge stigma in our society.
It's funny when you say that. I mean, I look at it from the flip point of view. I mean, I see road rage here, some young P-plater yelling at some elderly person, "Get off the road, you silly old fuck," that type of thing. I couldn't imagine that happening in China. And for example, because the Chinese hold these elderly, wiser people in such esteem and they feel better about themselves, I can actually see that playing into it. And it's like atrophy, use your brain more actively. It'll work longer, like a muscle. Don't use it. It's not going to work too well.
Absolutely. And you asked me earlier, what are some of the signs and symptoms? I'll tell you some of the unusual, really early signs. Loss of smell. This is a red flag. Well, there could be a lot of reasons for loss. You could have a cold for a start. You could be snorting cocaine, whatever. But if there's nothing else going on, if you notice a loss of smell, it may be Parkinson's. It may be a sign of dementia, particularly Alzheimer's. And firstly, let me just differentiate between dementia and Alzheimer's because most people are unaware of the difference. Dementia is an umbrella term for more than 100 different diseases, but all of them lead to progressive decline in brain function that interferes with daily life. And Alzheimer's disease is the most common type of dementia. It accounts for 60 to 70% of cases. That's why we hear the most about it, and that's why they're often used interchangeably. But the word dementia is like cancer, lots of different types, and the area of the brain affected does influence the symptoms. But the most common symptoms will be short-term memory loss, just starting to get a bit more confused, difficulty concentrating, repeating oneself in conversation, sensory deficits, as well, apart from the loss of smell. Midlife hearing loss is actually a big risk factor. So if you notice your hearing going, just get it fixed. And once you get your hearing, your hearing aids or whatever you need, you've reduced that risk again. Also, personality changes, errors of judgment, inability to plan or follow instructions, those little things where you're not quite sure if things are changing or not, but they're things to look out for. Also, loss of sense of humour, inability to get jokes because jokes are actually quite complex. And if you want to do a simple test for yourself or someone else, draw a clock face and, mark in 11 a.m. or 10 past 11 and a person with dementia is unable to draw a clock face because it's another really complex thing. The other thing we probably don't really notice in ourselves so much, but other people might notice, is driving skills start to diminish in a very subtle way. And a lot of people don't like driving at night, but they really notice that their driving skills diminish significantly at night. They tend to brake later. They brake more suddenly. They don't notice things as much. So there's a lot of subtle things, and it's just being aware of change. If you've always been slow at getting jokes, then it's not a sign. But if suddenly you can't do things you used to be able to do, you don't get things you used to be able to get, that's when I would go and get a formal assessment, starting with your GP.
There's only one thing I'm going to pull you up on, and I do this tongue-in-cheek. You said jokes are rather complex. They used to be. We used to have the likes of Robin Williams. These days I turn on the ABC and get the likes of Jim Jeffries. They're not quite as quick as what they used to be. So you could lose your faculties over the last 2 decades and not even realise when it comes to humour. So when it comes to what you said, you lose the sense of smell. I've always thought that those two, smell and taste, were intertwined. Is that the case also? You will lose your taste somewhat as well?
It hasn't been tested But yes, smell and taste are intertwined. But I have good news for you. They've actually done studies where people whose smell has started to decline, when they actually retrain their smell. So they get them to smell a range of different things: peppermint, lemon, coffee, olives, lavender, rose, and they just sniff it for 20 seconds, each one of these different smells, and really absorb it every morning, every evening, and their smell improves, and their cognition and their memory also improves. So that's an easy fix.
I love that. So you can recalibrate your sense of smell. It's like you put a new fuel tank in a car. You got to show it where full is, show it where empty is, and it figures out everything. I love that. You can do that. Something I noticed with my friend, we would drive up in the car, and when I first met him, would tell me all these wonderful stories. I mean, some that I could never repeat, some that are just phenomenal, involving some very big names, and you'd hear these stories. And then maybe 6 months later, I'd hear one of those stories again, then another story again. And I didn't say, oh, you've told me that, or end it. I just sit there and listen. A few years roll on, and I'm getting the same stories, sometimes a month apart. Towards the end, to the point where our friends had to say, I think it's time to give up what you're doing. I mean, I was getting the same story sometimes once on the way up to work, and the same story twice in the car on the way back. And you could sense it. And these things that we really do need to keep an eye on.
That's very common with Alzheimer's, repeating oneself. Very, very common. It's definitely a red flag.
What are other red flags? Oh, sorry, before I ask that question, my understanding of the way that it works is it's a series of micro bleeds in the brain. Is that correct? Is that part of
that? That can contribute. There are several hallmarks of Alzheimer's disease, and the main one is that certain regions of the brain, particularly the hippocampus, are no longer able to use glucose for fuel as efficiently as in the past. So your brain is deficient in energy, and that sets up a whole cascade of other things happening in the brain. There are little organelles in our cells, in all our cells, but mostly there are many of them in our brain cells called mitochondria. They start to not function as well. We get increased inflammation. This then leads to a buildup of two toxic proteins in our brain. One is called amyloid plaques, and they are outside cells, and there's tau tangles, and they are inside cells. And this is what the drugs have been targeting, removing the amyloid or trying to remove the tau. And even though drugs can very effectively remove amyloid from the brain, there seems to be little improvement in symptoms. In fact, there is no improvement in symptoms. In some cases, it may only a little bit slow down decline. And the reason being, by the time you've got amyloid and tau, they are responding to the insights that have already occurred in the brain. We have to target the loss of energy, the inflammation, much earlier. And there is also a lot of theories that infections can be a cause. Another easy fix, if you like, is keep on top of your dental health, because the bacteria causing gum disease called Porphyromonas gingivalis, try saying that after a few glasses of wine, but that bacteria can actually travel to the brain and damage areas involved in memory and learning. And so if people have bleeding, sore gums, inflamed gums, this significantly increases the risk of dementia, but not just dementia, heart disease, arthritis, but it is a really important one. So in answer to your question, microbleeds can occur. Yes, if you've had a stroke, which is a major bleed, or microbleeds, they can certainly increase the risk of Alzheimer's, because it reduces the delivery of oxygen and nutrients to the brain. But that's certainly not the only cause. And there is a type of dementia called vascular dementia that is affected by high blood pressure, heart failure, heart disease in general. That significantly increases the risk of vascular dementia, which is the second most common type.
I'm guessing another major factor, and one that my friend was very worried about prior to the diagnosis, was that his father and his mother both ended up with dementia. Genetics, how big a part does that play?
Well, there are two categories of genes related to Alzheimer's disease. It's important to know the difference. One category is referred to as deterministic. Now, that means if you inherit the gene, you're guaranteed to get Alzheimer's. And fortunately, this is rare, only accounts for about 1% of cases of Alzheimer's. And the three genes in this category are called presenilin 1, presenilin 2, and amyloid precursor protein. Now, if one of your parents, if either of your parents carries one of these genes, there's a 50% chance that you will inherit that gene, because you're going to inherit one. You might inherit the good gene, you might inherit the deterministic gene. And if you get that gene, unfortunately, so far, you will get Alzheimer's. But as I said, that is the minority. The second category of genes relating to Alzheimer's is referred to as risk factor genes. If you inherit a risk factor gene, and the best known of those is ApoE4, you are more prone to getting Alzheimer's, but by no means guaranteed to get the disease. And in fact, people with the ApoE4 gene who engage in healthy brain habits can lower their risk of Alzheimer's to that of someone without the gene.
Well, and I've always, we're running out of time. I've always said prevention is better than cure. And you've got a book out. It is called Can Adventure, you can get it, I should say, where people can get it. Adventure Prevents Dementia.com. That is where you can get Dr. Helena Popovic's book. And everybody, go buy it for somebody you love, because I promise you it could be a gift that keeps on giving. Dr. Helena Popovic, thank you so much.
So many things we can do. We haven't even scratched the surface.
Thank you so much for coming on.
Thank you.
Buy that for a friend. What a terrific gift that would be. We're going to come back with Dr. Isaac Gross here on the other side of the news.